Well, hello, everyone. I'm coming to you from the 8th Annual New York State CEI Sexual Health Conference. And I'm very pleased to be here with Dr. Jason Zucker. Dr. Zucker is a assistant professor in adult and pediatric infectious diseases at Columbia University Irving Medical Center. And he is the principal author of the recently released Questions, Answers, and Best Practices for Expedited Partner Therapy that was put out by part of the New York State AIDS Institute Clinical Guidelines Program. So Dr. Zucker, welcome. I'm very happy to have you here. And we just want to sort of tell our attendees of our conference a bit about the document that you wrote. So can you tell me a little bit about what the AIDS Institute asked of you?
Absolutely. So the AIDS Institute asked me to put together some best practices for expedited partner therapy. For those who don't know, expedited partner therapy is the ability to treat partners of patients who test positive for an STI without seeing the partner in clinic or for a visit. You're able to just prescribe either a prescription or medications to the patient to give to their partner. And so it's an opportunity to really make a dent in the rising rates of sexually transmitted infections.
Yeah, and so I'm aware that the New York State law had changed not too long ago, I think just before COVID. Can you update us on that a little bit?
Absolutely. So prior to January 1st, 2020, New York State only allowed expedited partner therapy for patients diagnosed with chlamydia. They then updated the law to say that that expedited partner therapy could be used for anything that the CDC said it could be used for. And so based on the updated CDC guidelines, the recommendations now is that you can use expedited partner therapy for patients who test positive for gonorrhea, chlamydia, or trichomonas. And just as a reminder, we don't use expedited partner therapy for patients who test positive for syphilis. We still want to make sure to bring those partners in to get them tested both for syphilis and HIV and make sure they receive adequate treatment.
Okay, great. And I know that in the past, when this law first came out, which I think in New York State was in 2010, just for chlamydia, it took quite a long time, I think a few years actually, before the regulations that accompany the law were issued. And that is true again, it seems. So there are no New York State official regulations. And that's one reason why this document really can be so helpful, because it's a kind of a how-to guide. Is that what you would say?
I think that's exactly right. You know, we tried to take the questions that we frequently get asked from providers about expedited partner therapy. You know, what is it? Who's it for? How do we provide it? And put it all into one easy place that providers can look at to help them add EPT to their clinical practice.
Yeah, I found it to be particularly helpful. There's a table in there that goes through all the exact medications and dosages, which is, one of the most frequent questions, I guess. And then even though this is really not to go over the whole document, in this little video, but I have to ask you the most common question that comes up, I think, is how do you do this with electronic health records? So you want to take a stab at that?
Sure. I think that remains one of the biggest challenges. You know, New York State actually has an exemption for expedited partner therapy for electronic prescribing. And so if you do have a prescription pad in your office or access to a prescription, you can do it that way on a paper prescription still. Obviously, many practices have phased out paper prescriptions in favor of electronic prescribing. In here, we do have some tips and tricks for ways to do electronic prescribing, but it's definitely a challenge as many EMRs don't support it out of the box, and you need to work with your EMR vendor to try to support it. You know, one thing not to do, though, as a reminder to people, is not to prescribe a double dose of medication to the patient. It is technically Medicaid fraud for a patient to be billed for their partner's medication. So we advise against doing that, but certainly working with your EMR to find other ways to be able to send scripts electronically.
Okay. And yeah, that is a real helpful tip. We have in our own practice been able to get a hold of paper prescriptions that print out in our printer, where our after visit summary prints. And so, from the provider's perspective, it feels like you are doing an electronic prescription because you're still doing it in the electronic record, but you end up with a paper prescription at the other end, along with the educational handouts.
And that's a fantastic way to do it for places that have prescription printers. That we can do that as well in our clinic. We can also print out blank scripts and write on them, which is one way to do it. But we're working on sort of more advanced ways to be able to send it directly to the pharmacy to make things easier.
Yeah, great. So do you have any tips for clinicians who have never dipped their toe into the EPT world, where it does feel a little nerve-wracking about giving a prescription to someone where you haven't taken an allergy history, for instance?
Yeah. So, there's great documentation on the New York State website now that you can give to patients to give to their partner with the medication or with the prescription. So that includes information about allergies so that the partner is fully informed about potential allergies, information about the medication themselves and potential side effects, and then information on who to contact or where they can get follow-up after the diagnosis. The best recommendation I can make is that you should try it in your practice. If you have patients who test positive for STIs, you should be offering EPT and working with them to do it. I'm constantly amazed. I often used to think that patients might not want to do this or they might be embarrassed to tell their partner, but many patients want to get their partners treated and want to make sure their partners get the highest level of care as well. And this is one way to do that, especially for patients whose partners maybe have full-time jobs and can't take off during the day to come to clinic or other things. It's a great opportunity to do it. One way to feel more comfortable is that many of my patients will actually call their partner. And while I don't get to see their partner for a visit, I can talk to them on the phone. I can ask them about allergies. I can ask them about pregnancy status. I can ask them other questions. And that's one way that may make you feel more comfortable about it. But the most important thing, especially with rising STI rates, is to just make sure we offer everybody treatment and we offer their partners treatment as well.
Okay. Well, that seems like a good place to end. So thanks so much for joining us today, and thank you for your work in putting together, such a helpful document.